Very good morning, guys. Very good morning. So, welcome to Psychiatry Inicet topics. We'll discuss something relating sleep disorders. Right. So, first of all, most of the times you will be getting questions regarding night terrors and nightmares. But you should understand the main difference, key differences between night terrors and nightmares. But remember this. Both are actually examples of parasomnia. Okay, both are actually examples of parasomnia. This is very important. Remember. So, right here, night terrors are also called pavor nocturnus. Pavor nocturnus, that's called pavor nocturnus, and here you write nightmares. Okay, so most of the time these night terrors or pavor nocturnus are seen in adolescents and young children. Remember, whereas nightmares, they can be observed in any age. This is important. Most of the times you will be given with an option called old age, but no, nightmares you can see in any age. But night terrors, or also called pavor nocturnus, actually mostly seen in adolescents and young children, and it is generally seen in N3 stage of sleep. I explained the stages of sleep, you please check in the videos, right? N3 stage of sleep. But nightmares are seen in REM sleep, that is rapid eye movement of sleep. Okay, now here you might you might experience amnesia, loss of a short memory, but here you will remember that nightmare very crystal clearly. You don't forget it, but here you will have amnesia, simply you can forget that. Okay, so there will be a autonomic arousal. In case of night terrors, there will be autonomic arousal. Can you tell me what you will present with that? Tachycardia as well as tremors, right? And also you might experience with post arousal confusion. You might experience post arousal confusion, but here these all things not seen, nothing is seen, right? So the most important thing here that you should remember is the stage, in which stage you will see night terrors or pavor nocturnus, and in which stage you will see nightmares seen in REM type of sleep, and night terrors or pavor nocturnus are seen in N3 stage of sleep. Here amnesia might be present, that is loss of memory. Here it cannot be forget, that is it can be crystal clear, be remembered. Okay, in nightmares. That's it. Now we will discuss something more important topic, that is narcolepsy. AIMS professor's fan favorite, INICET most probable MCQ topic, narcolepsy. So it is actually a type of dysomnia, and if you ask me, sir, what is the underlying pathology? Now this is what the MCQ can be. There is a decreased orexin or hypocretin. You can also deal it as hypocretin. Now if you ask me, sir, what are the clinical features of narcolepsy? Simple. Mostly there will be daytime sleep attacks. So the patient mostly sleep at morning. The patient loves to sleep in morning. There is a decreased sleep latency and REM latency. And you can remember one more thing, there is a SOREM can also occur. Can someone tell me what is meant by SOREM? SOREM means nothing but sleep onset rapid eye movement. That is called SOREM. Don't get confused, okay? And there can also be something called hypnagogic and hypnopompic hallucinations. Okay, now this is very important. There can be an exhibition of a feature called cataplexy. There can be an exhibition of feature called cataplexy. Cataplexy means there can be a loss of muscle tone in emotional situations and collapse of and there can be a collapse, not collapse of, there can be a collapse. Okay, now you heard about this cataplexy. Can you tell me where? You already studied this cataplexy. Cataplexy is seen in where? Cataplexy is seen in, this is an extra point, very simple, catatonia. Cataplexy is seen in catatonia. Now what is the treatment? This is the Neet PG question. This is a Neet PG question. What is the treatment of narcolepsy? I am writing it brightly, so please try to remember. It is modafinil. How does the modafinil act? It is a dopamine reuptake inhibitor. It is dopamine reuptake inhibitor. Okay, now that is all about narcolepsy. Okay, thank you. In the next section we will meet your wise doctor. Okay, thank you.